Hey everybody, joining your Little Survival. So today we're going to be doing Trauma 101, a new mini-series we're going to start on my channel about medical. Stick around. So Trauma 101, guys, here on this channel is going to be taught in a mini-series. It's going to be mostly surrounding the acronyms MARCH PAWS. So MARCH PAWS, for those who don't know, stands for Massive Bleeding, Airway, Respiratory, Circulation, Head and Heat. The PAWS section is Pain Management, Antibiotics, Wounds, and Splinting. Now, this does have a practical use every single day because you never know when an emergency situation is going to happen to you or someone you care about or a total stranger nearby. Now, that being said, I just want to share a little bit about myself so you guys feel a little more comfortable learning from me. Yes, I'm a certified licensed EMT in the state of Michigan. I do have the formal education, training, and experience to back up what I'm talking about, so please feel a little more at ease. Now, why do we want to learn this stuff? Well, some facts to kind of chew on here, especially here in the United States. Did you know, roughly here in our country, again, the United States, nearly 60,000 people every single year die from a treatable massive bleed or a massive hemorrhage? Every single year. That could be you. That could be your significant other, whether it's your wife or husband or boyfriend or girlfriend, whatever it's going to be. It could be your child. It could be your children. It could be your friend or friends. It could be random stranger or strangers that might need your help. I believe most people in society are actually good, decent people, and they don't want to see that. They actually want to help. But they might lack the knowledge, the skills, and the equipment, and redundancies, by the way, to actually administer aid to save someone's life. So that's number one. Number two, kind of scary fact for me personally, because I live in the rural United States, as is most of the United States is actually rural, small communities. The response time, and I can vouch for this personally, because I work EMS in my rural area, from the time the call is placed with 911, they dispatch EMS, and EMS gets to the patient can vary. It could be 5 to 7 minutes. It could be 14 plus minutes, depending on where you live at, right? That's a long time for an emergency situation to go on, believe it or not. So say your friend cuts their leg open with a chainsaw, an actual thing that happened to my brother-in-law's friend. That's a long time to sit there and let them bleed out. They're going to be dead, more than likely by the time you get there. Because you can bleed to death to an unconscious state from 60 to 90 seconds, and then you're going to be unconscious, you can't render self-aid, right? So you better hope that you're not by yourself and that person who's with you knows what to do and they have equipment with them. If not, not a good day. So, where do most of these actual events spawn from? Well, it's something that you and I do every single day, and this applies to everybody in the world. Can you guys guess what it is? That's right, it's driving. I guarantee you, probably sometime today, yesterday, maybe tomorrow, you're planning on driving or you did drive somewhere, right? Either to work, back to work, drop your kids off at school, doing some errands, whatever the case may be, but you got inside that big metal object and you went at a certain rate of speed, whatever the speed limit is. Say some jackwagon pulls out in front of you, you T-bone them, or maybe they T-bone you, or somebody rear-ends you, or maybe you're lucky to see all this stuff happening and you're like, whoop, into the ditch you go. However, now you've rolled your vehicle, or maybe you hit a tree, whatever the case may be, right? But think about this. How much stuff's in your vehicle? Okay? Especially as a parent, like me. You know, my kids brought rocks, I have tools in there, I have God knows what else in there because of my family. But all these things in there, especially when I'm rolling the vehicle and the airbag deploys, okay, all that stuff's flying around, hitting me, cutting me, possibly bruising me up. It's not a good day. Airbag goes off. All that stuff's coming towards my body at about 200 miles per hour. That's going to do some damage. Plastic becoming jagged inside the vehicle because it's getting broken apart, sticking out at random angles. Metal piercing through the vehicle, God knows where, because it's a wreck. You know, I've seen both. Like, I've seen a horrible wreck. People were okay. Nothing. Minor injuries. I've seen a wreck. Person's dead. Not a good situation. So, that being said, next one is falls. Yeah, sure, we can talk about the outdoors. I mean, falls happen all the time outdoors. I mean, hiking, climbing, you know, whatever. I mean, other emergencies are hypothermia because you dump your canoe, you fall in a river, whatever it's going to be. But, I mean, falls in a practical sense at home, think about it. You could lose your footing on your stairs, tumble down the stairs, or your child could. I mean, anybody else with toddlers knows what I'm talking about. You know, that could be a serious fall. That could really affect them bad. Or if you have an elderly person living with you, whether it's your mother or father or whatever, even from standing height, say they have osteoporosis or just weak bones period from age, they could just fall from standing height and break their shoulder, their hip, their humerus, their forearm, whatever, right? Not a good day. Not a good day. So you better have stuff on hand, especially if, say, they break a bone, it's a compound fracture, it's hit an artery, not spurting blood everywhere. You're going to want equipment on hand to treat that. Number 3 and 4, I combined into one thing. I don't know how YouTube's going to feel about it, but I'm going to say it. Mass shootings, mass stabbings. These things do happen. Or, all the way to more common, the actual singular events, right? Gang violence, you're caught in the middle. Could be some random psycho chasing you with a sharp object or trying to shoot you for no reason, whatever, trying to rob you. Not a good day. You better have the knowledge, skills, and equipment on hand to take care of the situation so you survive. Now, we're going to talk about the stages here. Stage 1 is everyday life, okay? 911's available, hospitals are here, the system of care is good. Emergency happens, you use march paws to take care of your friend that got injured, or your spouse, your child, whatever. You know, you do your thing, stop the bleeding, maybe splint a wound or whatever. EMS shows up, they might stay and play for a little bit, load and go, take them to the hospital. You saved a life, good job. I'm proud of you. Where this stuff really starts to shine more so is number 2, 2.5, I'll say, and 3, okay? Stage 2 is going to be your natural disasters. This is the best example I could really think of. Okay, extended emergent situations. So natural disasters, say the aftermath of tornadoes, earthquakes, floods, wildfires, blizzards, hurricanes. I mean, heck, Hurricane Helene. Have you guys seen video footage of that? Have you seen pictures of the aftermath? Holy devastation. These poor people. You know, Yahweh be with them. But the thing is this, though, I could not imagine my wife, my child, or children being injured in the aftermath of that storm, all messed up. You know, you're going to want to know what to do. You're going to want stuff on hand and redundancies again to take care of the stuff that happened to them. Or your friend, this random stranger, whatever. Be a good, decent person. Now, stage 2.5, I want to kind of step off to the side here so you guys can read this and do with this information what you will. I personally am not much of a date guy when it comes to predicted events, right? But this is a little fishy to me. Now, terrorist events, okay, here in the United States, Europe, wherever you guys are watching this from, it is a realistic thing nowadays, okay, especially here in the United States. I'm going to speak to my fellow Americans. We had a porous border for the last 4 years. People just flooded in. We don't know who they are. A lot of people got away, okay, unchecked, unvetted. Who's here in the homeland? We don't know, okay. Yeah, sure, the southern border is mostly sealed off, depending on what news source you listen to. But the northern border, pretty porous still. We don't know, again, who's coming in unchecked, unvetted. A lot of geopolitical tension happening. Okay, World War III is pretty close. Closer than it's ever been, allegedly so. Along with that, we have a lot of political and societal tension here in the United States. Things can go south pretty bad, pretty quick. So that's stage 2. Emergent situations. Stage 2.5 is the terroristical civil war kind of scenario. Stage 3 is COG, shit's the fan, grid down, I don't care what you call it, but it's that situation there, okay? So no help's coming. Why? Because EMS, the network, the hospital chain is broken down. Either completely or so jam-packed and you're waiting hours on end for help. There's just no point. Excuse me 1 second. Sorry about that. So that brings me to the question, when should we learn these skill sets for ourselves? Today at some point in time. I don't care if it's for me, I don't care if it's some other YouTuber, whatever, okay? Learn these skill sets today. Please do yourself a favor. And please consider, well, actually, I'll save that for a bit. Hold on a second, I'm sorry. But today, where should you learn this from? Okay, first and foremost, you should learn this from an actual formal educational course. So the best would be in-person physical classes, okay? So you can get the formal education and the training to back up the skills you're going to learn there. So think stop the bleed classes, first aid classes if you're more so the lay person, not really involved in the medical field. Don't have a big interest in the stuff, which you should learn all the way up to EMT skill level, but you do you. Now, that's the other thing too. Get an EMR class, okay, or an EMT class in there as well. Get the physical, hands-on training. Just look up the program, make sure they actually do a good job training people, okay? And if it costs a lot, maybe you can work out with the agency like, hey, I'll work this many hours or for a year or whatever, I'll sign a contract if I can take this course for free. Most agencies actually offer that. You just got to ask. At least from my personal information I found. Now, who should be taught this stuff? Quite simply, anybody that is old enough to understand the context of what's being taught, okay? And they can turn around after it's being done, instructed, taught, whatever, right? And implement this in front of you. So I don't care if the person's 10 or 90 or 102 to 12, whatever, right? Or somewhere in between. I don't care. As long as they can understand what's being taught and they can sit there and implement it. Okay, good to go. That person should learn this stuff. or anywhere in between. Now, that being said, I understand it's a little scary to kind of approach people about this stuff, and some people don't like to talk in crowds or whatever. It does get better with time. It does get fun, but a good way to teach people this stuff is EDI. Okay, you're going to educate the subject matter. Okay, educate. The D is for demonstrate. You're going to demonstrate to your students, your family members, friends, whatever it's going to be, what to do with whatever skill set you want them to practice, and they're going to imitate what they just got educated and demonstrated to, so they can actually show you, hey, I understand what's going on, right? And from there, always sit there and relearn these skills again. Keep up to date, because medical information does change over time. Skills do change over time. Make sure you have redundancies in your equipment and a willingness to help. So anyways, guys, that's the first installment of Trauma 101. Hope you guys found this interesting. Please like, share, subscribe, and as always, stay frosty, prep up. God bless.